So
yeah, actually, I think that's our cue. Let's get started.
let's go.
Yeah, as Gita said, thank you so much for joining us. I'm Julie Patel-Liss. I'm the president of the Asian American Journalists Association of Los Angeles and the head of journalism at Cal State LA. As Gita mentioned earlier, I am also so impressed with you all for taking time out of your evening to join us for something that's serious, that's, important and impactful in the lives of our readers, our listeners, and our viewers. We encourage you to look into our website, AAJA-LA.org, to find out more information about some of the health justice grants that Gita mentioned. Ada Seng, one of our coordinators of this event and our health justice programming this year, will actually provide tips at the end of this event if you're interested in applying for one of those $2,500 fellowships. I want to thank Cal Endow for the health justice grant that we received that is paying for a lot of our programming this year. We have another event coming up in late June, early July, which will be in person, and it'll be all about community engagement related to health injustices. We also have some convention grants that I want to let people know about, up to $500. So please go on our website and apply for those if you plan on going to the convention and you need help getting there. We have a training grant with the LA Times in honor of Greg Yee. And so, yeah, we'll talk about that and more at the end of this event. First, I want to start with our amazing moderator today. I think some of you already met her, Gita Amar. Before she introduces our panelists, let me introduce her. Gita is an AAJA-LA advisory board member. She's senior vice president of GCI Health, and she's on the board of the local Public Relations Society of America. She's a commentator for various BBC shows. She's been a producer for Fox and NPR, Good Day LA, and many others. She's served in senior roles at different PR firms and agencies like Fleishman Hillard and others. And yeah, she went to UCLA, where she started her journalism career at the Daily Bruin and at the radio station there. And she has a law degree and a master's degree in communications. So yeah, thank you, Gita, so much for doing this. And I want to thank Agnes Constante and Ada Seng as well for helping coordinate all these events.
Thank you, Julie. I really appreciate that. Yes, we could not do this event without Agnes and Ada, and also our former president, Teresa Watanabe, who's the education reporter at the LA Times. She puts a lot of time into this as well and bringing us all together. And the reason we are doing this and having this evening together on how to report on health in any beat is because we know in California, where we have over 40 million residents, that health is of utmost importance. People call this the golden state, but we know that everybody doesn't have a golden healthcare system. And 1 in 3 people in California are on Medi-Cal, but there's so many others that need health support services. And we're going to talk about why you should cover the health beat, what is a health beat, and why it's so important. One of the things that I always remember when I went to school back at Newhouse was that they would say Nellie Bly was a health reporter. And I'd be like, why is Nellie Bly a health reporter? Because Nellie Bly went into at that time, a mental hospital, and she went undercover, so to speak, to reveal the conditions. And that was over almost, I think, about 140 years ago when she was doing that. So it's the health beat has evolved, but in some cases, we're still talking about issues such as mental illness, access to healthcare, transportation, food and justice issues. And those are all things that come up in the health beat, and people are like, whoa, how do you get there? So I would like to discuss with our esteemed panel how they cover these stories, how they got into the healthcare beat, and what, especially in California, are stories that we could focus on, that some of our fellows, if you are so great to join us, would be willing to write about and help discover. So let's start off. I'm going to do like a around the world and have everybody who's here, who's on our panel, introduce themselves, tell us where you work and how you first started. We'll start, Diya, with you because we see you first over there, and tell us where you are now, where you worked before, because some of us may have read your coronavirus newsletter, and then we'll go and do questions. But let's kick it off, Diya, with you first.
Sure. Hi, everyone. It's really great to be here. My name is Diya Chacko, and I'm a science editor at UCLA Health. I work in the communications department, and I edit all kinds of content about science and research and health. Before this, I was at the Los Angeles Times, where I was on the audience engagement team for the Metro section. And I wrote the daily coronavirus newsletter when it was first launched back in March of 2020. It was a crazy time. And they had asked me to do that because I had experience in digital and in, audience engagement and building communities, but I'd also had experience in healthcare and health reporting. My very first job after grad school was with a nonprofit startup out of USC, also funded by Cal Endowment, in fact, where we would partner with newspapers, daily newspapers, to do long form series on healthcare. So my big first package that I did was for the LA Daily News, and it was on young people being able to get back onto their parents' insurance with the Affordable Care Act. It was specifically, I read the Affordable Care Act and I picked out some details and I pursued those stories. So I talked to a lot of young people and specifically the movie industry and the entertainment industry about what it would mean for them to be able to get back on their parents' insurance when they're pursuing these careers that don't come with health insurance. After that, I, went through daily news. Went through local news and sort of worked my way up as you do in newspapers. And before I was at the LA Times, I was also the public health and environment editor for the Orange County Register. And so those are all my health related jobs. And, it's kind of funny to still be in the health realm. I'm still, looking at stories and trying to figure out stories just from, the other side of things, not so much from journalism anymore, but, in terms of being actually at a hospital and putting out content for people. And that's me.
That's great. Thank you so much, Diya. And we'll come back to discussing what it's like to get those stories out of hospital. Then next, I'd like to have Lexis Olivier-Ray talk to us. And he's coming from his newsroom, or what were you telling us it was? What type of space?
This is my private photo studio and office, which happens to be across the hall from LA Taco. So yeah, I'm a staff investigative reporter at LA Taco, but we're a really small team, so everyone kind of wears a bunch of different hats. I got into health reporting a couple years ago at the start of the pandemic, when I started looking into hygiene stations that the city had rolled out to unhoused encampments across the city. Long story short, I looked into these hygiene stations for years and basically found that the city wasn't living up to their promise of assessing these hygiene stations on a daily basis. And vendors were essentially getting paid, I think, millions of dollars to do work, or getting paid for work that they weren't actually completing. So I did that project through a fellowship with the University for California Center for Health Journalism. And it was a data fellowship. So as I was getting into health reporting, I was also getting into data reporting. And this was when I was still a freelancer, wasn't full-time for LA Taco yet. So I was also, reporting on protests and doing like culture features for KCET and other work for other news organizations as well. And then on top of that, just being a reporter during the pandemic, I think kind of forced all reporters to, in some ways, become health reporters. Everyone from food writers, to myself reporting on like homelessness and police. There's just so many intersections with health. So I got really into keeping track of COVID data, did a lot of stories about like masks and outbreaks and shelters and police stations and such. And then more recently, I did another fellowship with Center for Health Journalism, centered on sanitation cleanings, also known as homeless sweeps. And I looked at the impact of these sweeps and displacement on unhoused people's physical and mental health. Going back to the first project, I also got an engagement grant from the center as well, and did a lot of engagement work around hygiene stations, but also other issues. That's kind of what led to the story on sweeps. And I established a text messaging service that is geared towards unhoused people as well as service providers. And through that texting service, I've done everything from send out sanitation schedules to, early in the pandemic, sending out information about COVID and vaccines, other resources. I've done Q&As with people to answer questions. And I also use it as a resource to, collect ideas for stories and interview people, find sources and such. So I've been able to grow that texting service to over 150 subscribers now, and kept it going for a little over 2 years now. So that's kind of the story of how I got into health reporting.
Thank you, Lex. That's so interesting. And I think a lot of people in the city look to that, and in California are looking around nationwide, seeing what you're doing. It's quite innovative reporting to look at. So now, Usha, why don't we'll go to you. Tell us about yourself. As some of the people on the panel have said that they look to you with a lot of respect, because you have been a role model for many reporters out there and journalists out there. And I know Usha is very modest about what she does, but we have to say that we're very pleased that she could join us tonight, and even though she's right back from Boston. So Usha, for those who don't know a lot about how you got your start and what you do, please fill us in.
Sure. Well, I'm really happy to be here. I love the work of everybody on this panel. I'm so inspired by Lex's work, actually. I'm so happy to just even meet him. I cover health disparities for STAT, which is part of the Boston Globe. And that was directly born out of the COVID pandemic. My first story was just calling community health centers around Los Angeles, like very early on, like late March. And they're like, it's our Hispanic patients, it's the frontline workers. And this was way before the CDC, it was way before everyone like realized that. I think LA is such a, and California, we're like a lab for health disparities, right? It's all right here. And it was so interesting because it was like, some community health centers just had like Bengali patients, and, we've got everybody here and everybody's problems. But I started, my very first job was in San Antonio, Texas. And I always wanted to be a health and science writer, but I was just like metro. I wasn't even metro. I was neighborhood. So I was like a teeny nobody on the staff. But I was thinking back to it, and even then there's health stories everywhere. So I covered like people that were getting leprosy from the armadillos they were taxidermying, and there were rabies outbreaks, and there were sadly like birth defects from people who drank out of the Rio Grande River, because the colonias, the housing settlements with no facilities, there just was no running water. So people did what they could. So I do think stories are everywhere, and on any beat and any size, any type of publication, and excited to talk about that tonight.
Thank you. Next, we're going to go to Emily. Emily joins us, and she's from the Pulitzer Prize winning newsroom of the LA Times, and just was part of a Pulitzer Prize winning team. So we're right on the cusp of that with Emily.
I keep joking, it's like the tiniest quarter of a Pulitzer, but
it doesn't matter. It's a Pulitzer. We're seem to have 2 Pulitzer Prize winners here, I must say. So, and everybody else has won numerous awards. I've read about Lex's awards, like he's in categories with Trevor Noah. I'm like, oh my goodness, and Billy and Diya. So we've got quite the award-winning panel. So Emily, tell us about yourself and how you came to the Health Beat, and what you work on.
Yeah, so I cover public health for the LA Times. I've been on the beat for a little less than 2 years now, so it still feels very, very new to me. I started off in journalism at a small paper called The Dispatch in Gilroy. If you know it, you probably know it as the home of the Garlic Festival, which we had wall-to-wall coverage of. From there, I went to a nonprofit website that does enterprise and investigative reporting called Voice of San Diego, where I covered education. And the same day I got laid off from there, I interviewed at the LA Times. It was a very stressful day. But I've been at the LA Times for about 10 years now. Most of that time has been covering Los Angeles City Hall, so city politics and government. But I've also covered the census and demographics, and was working on an international news blog for a little bit. So that's enough about it.
So let's talk about, one of the questions I'm going to throw out there is let's just talk about the health beat now, and maybe a little bit about what you're seeing in California, because let's focus on the state first. This is, as you said, this state is kind of a laboratory for everything. Usha was mentioning it with COVID, but and anyone can all start off, or you could start off with what you think are some stories that you would like to cover that you may not have, or that you find are shocking in the sense of health disparities that you didn't think would take place. You know, Lex, you see a lot, I think, with what's happening in Los Angeles. You know, I call on you first, but because of, we know that you work with the unhoused community and what you're doing. So are there things that you think aren't getting coverage? Are there things that you're noticing in California that if you read other folks or talk to your fellow reporters across the country that they are not dealing with?
Yeah, I mean, I think a lot of people have their eyes on like evictions and homelessness getting worse. You know, now that a lot of emergency protections are ending. LA Public Health just put out a report. Emily actually wrote a story about it, but just about, you know, homeless deaths and how there's been a real increase in overdose deaths. Another thing that kind of caught me by surprise was that unhoused people were, I think, 80% more likely to die from COVID. So what we're seeing is, I think, we're having like a you know, a deeper understanding of how the pandemic impacts communities like the unhoused community, for instance. We're only like kind of just now getting that data. So that's a little bit of what I'm seeing as it relates to homelessness.
Diya, are you getting stories at UCLA where you're, you know, because you're in the university system and within California, throughout the rest of the UCs, seeing any other things that are coming up with health disparities or things like that? That
Yeah, I mean,
people may not think about. You know, you got it right away.
there's so many things. One story that I would love for people to cover and have more attention paid to it is the lack of diversity in clinical trials, and how that's affecting how medicine is done, how studies are written, like what data gets reported, what takeaways are there from these like very dense studies that just don't include even basic level, like women, people of color. And there are various factors around that. One is just that the outreach just doesn't happen, but then also the other factor is that the trust building just doesn't happen. There are a lot of folks who are unsure about the healthcare system, or suspicious of it, or wary of it. And for a lot of, you know, groups, they have good reason to be, because the healthcare system has not treated them well. So, but the thing is, now it's like kind of becoming a problem, because, you know, that means those people are left out of clinical trials, and therefore left out of, you know, the data and the results, and, you know, just, you know, healthcare in general.
Usha, do you have something that you're seeing or
Well, I was
noticing?
thinking about what Lex said, and Emily's story, and the fact that so many unhoused people are dying of COVID. And early on, people were saying, oh, these people aren't, you know, nobody's dying of COVID, and because they're outside and they're not, you know, they're not spreading it. And there was this sort of myth that went around that COVID wasn't harming people who were unhoused. And it turned, so I do think that's one lesson to take, is to just kind of ask questions. And if you're close to that community, or talking to either people who are unhoused or people who are helping them, you know, that's not true. And, you know, it's just, there were issues like your housing status isn't put on your death certificate. So you might have died of COVID, but not be listed as unhoused, or, you know, people are just listed as overdose death, like because of stereotypes, when it may be like something totally different. So I think like really just questioning these myths about marginalized people is really important in this kind of work. And I just think there's stories everywhere. I think the pandemic is just rippling through slowly and painfully. I think there's so much suffering. There's so much people slipping like out of the middle class into the lower middle class, out of the lower middle class, you know, into even worse. And people have neglected their health. Everyone's so exhausted. I was just thinking about school nurses, and like, so I'm hearing some, especially under-resourced schools don't even have nurses, and kids are facing so many like mental health issues. And so I just think there's, and health reporters are exhausted too. So we can't even cover all this stuff. So I think there's like so much fertile ground for like, especially maybe people who haven't been covering this or haven't been covering the pandemic since the emergency, like maybe have fresh eyes on it. So I like really welcome people coming from, covering courts or police or housing or education to kind of look for these health angles that are there, because these are things that affect all of us. They affect our families. They're stories that are often right in front of our faces that we don't realize can be news stories too.
I was thinking about this question, and I do feel like there is incredible attention to the idea, just to the existence of disparities right now.
Mhm.
And the thing that I think is missing is how we tell those stories. I brought this book to show you because it's such a good book. Please read this book. It's blurring because of my background. Anyway, it's called Viral Justice. It's by Ruha Benjamin. And she talks about how even like in kind of very well-intentioned discussions about disparities, sometimes we make it sound like the source of the disparity is with the marginalized person. Like, oh, these people are at higher risk because they are Black, because they're homeless, because, instead of saying, what is it about our systems that make them at higher risk? Who is actually perpetuating this? So she talks about how the study that we probably all know as the Tuskegee study, why do we name it for the people who were victimized by it, as opposed to the group that actually carried out the study? Most of us don't know the name of the group that carried out the study. So she kind of makes this point of why, how we should actually name things and what our focus should be. And so I think that's the main thing. I don't have a very concrete story idea out of it, but it's something I've been trying to think about a lot, is how do we make sure that when we talk about these things that we don't perpetuate this idea that there's just sort of a group of people who this is doomed to happen to, and that there's no agency in the kind of people who are powerful to change that. There was a story that I sent to Ada that came out, I want to say like a year ago, about how when a lot of the information about racial disparity in COVID came out, that white people kind of tuned out, that there's research sort of showing this, which kind of scares the heck out of me, right? Because I think it's incredibly important that we talk about these things, but how do we do so in a way that doesn't just kind of end up reinforcing this idea that this is the way the world works and there's no other way for it to work? And so I think making sure that the focus is on how are systems working, who is causing the harm is one of those really important things.
So one of the things we're all noticing and we're talking about is how the pandemic has shaped coverage. And, people were like reading health stories, or people were getting thrown into the health beat. Like you like Lex was saying, you could have covered food, you could have covered something, you had to do it. So now what are you noticing? Because we were wondering, as on being on the health beat, is it easier to cover certain stories? Is it harder? Is it getting worse that your editors are like, we don't want to pay attention anymore now that it's not considered a national problem, or WHO has not mandated it? Or what are you hearing also from readers too? So I just wanted to get some of your feedback on what you think has happened since since the COVID pandemic is supposedly allegedly over, but we also don't get reporting on it now from the Johns Hopkins meters because people can't even turn in the data that they would use to turn in. So I'd like to hear you talk about that, just because people are wondering who may be wanting to go into health reporting, like, is there really something to cover there, like you're talking on Earth, and why? When anyone want to start, or should we start with
So do you mean like, are there things other than COVID to cover, or whether there's
no, how has it been now? Because there are plenty of things to cover, but how has it been for your editors? How has it been, because you cover the health beat, you've come to cover the health beat, but for other people who may want to come into reporting on health in general, is the opportunity there for them to do this because the pandemic is over? How would you say that are things getting worse or better for for health beat reporters, so to speak? Because at one time everybody was focused on reading those stories, and people wanted to read coronavirus newsletters, or they would be listening to reports on radio about what was going on, or they would be wanting to get tweets on that. Have you noticed that health coverage is either growing on other things, or is it dying down, so to speak?
I mean, I feel like because of COVID, we ignored so many other things. Even now, we're ignoring monkeypox. There's barely any coverage of it. And then just all those things we always had, like cancer and heart disease and diabetes. I think the obesity epidemic, I think just because so many of us were like very not active during the pandemic. I just think there's all the traditional health topics have not been covered as much because everybody went to COVID, and I don't feel like we've caught up. So I think there's tons of topics. I don't know if there's jobs, but I think you look at women's magazines, say the things that still sell on newsstands, and it's all health stories. That's what sells. It's what people want to know about. You see what's trending on Apple News. It's often health stuff. So I think there's tremendous opportunity out there. I don't know what shape it will take. Because we still have to sort of cover the secular. I don't think the pandemic's over. I think we're just in a weird, like, peri-pandemic state. So that has to be covered too.
No, that's what I was trying to get at. I wanted what the health reports say, that we still have to cover that, and also all these stories that have been ignored. All of these things, because people weren't going, they weren't getting even tested. They weren't getting their regular mammograms if they had the fortune to be able to get that, or they weren't getting tested for cancer. They would ignore other symptoms that were not COVID symptoms. So these are things that I wanted to bring up, and also rates of mortality, things like that. Those type of rates are still increasing amongst different populations. Now I want to ask all of you, how do you come up with your story ideas? We're going to go around, because for those who want to come to the Health Beat, what do you do to come up with your story ideas? What do you read? Where do you look for story ideas? How do you approach that? Diya, you've been on both ends of it, right?
Yeah, sure.
Writing newsletter, and you have and now you work at UCLA, which probably has a lot of story ideas to tell reporters about. So
Yes.
yeah,
Yeah.
on both sides of a pitch.
get-
Tell us about it.
Yeah, we get, my team is the content team. Luckily, we're not media relations, so we're not getting as many pitches from researchers about their latest study. We get to, find stories that interest us and write about them, which is amazing. It's such a great job. But I would say that I kind of, even when I was a health editor at the Orange County Register, what I would do is I would read various newsletters, not just from other, like Stat, for instance, or Axios, or in media newsletters specifically about health. I would also subscribe to newsletters from academic medical systems like UCLA. I would subscribe to, there's lots of weirdly written sometimes, but there's nuggets there. There are a lot of interesting biotech newsletters to subscribe to. There's there's, like, I would say, like, where institutions where science and research is happening in the health and medical space, those are good places to look at and see if they have some kind of publication, because they often do. And it's just not very many people pay attention to them. So there's good stories to be found there.
Emily, I'm going to call on you. You just did a great series on transplants and people waiting for 2 years to get a transplant. I read that.
Not even for a transplant, to get on the wait list.
Getting on a wait list, right? Waiting on a wait list. So how do you find those stories? How do you look for them? And what else do you read? Like, we're listening to, because I think people want to know, who have tuned in, or we would hope they would.
Well, I have kind of a funny, so in part because I came from a really small outlet before this, and I had kind of drilled into my head, like, I think we were a team of maybe like 9 covering San Diego, and the motto we had is, if we can't do it better than anyone else, we don't do it. So I read a lot of things to kind of know what's out there, know the context, and be informed. But like, if someone else has done the story, like, I kind of run the other way. Like, I'm like, what else can I do? Like, that's covered, it's good, I'm glad it's out there, So I mean, I find that the best things come from, as much as I can, just trying to like get out into settings where the work is happening, which, I mean, can be really hard in healthcare. But anytime I can get access to, literally just to kind of see what's going on in the hospital, or to go kind of tag along with an outreach team, or, and even if there's not necessarily a story that comes right out of that visit, building those relationships, and then, calling someone back and saying, what's great right now, what's making your life harder. Once people know to gripe to you, you get all kinds of great stuff. And so that's where I find kind of the best stuff comes from.
Lex, what about you? You have great sources, it seems to me.
Yeah, for me, it really varies. A lot of times it is news tips. I mean, I mentioned my text messaging service. I get a lot of tips from there, and also connected with a lot of sources. And since I've been reporting on homelessness for a while at this point, I've built up a lot of sources. But other times it's like on the ground reporting, or kind of what Emily was talking about. I feel like I have to usually do like a little bit of reporting. So sometimes it's like a few interviews, or obtaining public records. I found a lot of stories that way, or sometimes reading another story and reaching out for comment. Might find something there. But similar to Emily, I prefer to like be out in the field, and I prefer to hit the streets and find stories when I can, but it really does vary.
One of the other things that I wanted, go ahead, Usha, go ahead.
For me, actually, one of the best parts of lockdown was I just watched all these webinars. I was like a webinar addict. I was watching webinars like, because I couldn't leave the house. So I was just watching left and right, and I learned so much. And also those were so great as a reporter, because you could see how people communicate and tell stories. And so you could really realize like, oh, that person would be great to interview. And then sometimes there'd be, I remember there was a huge long New York Times story about like everything about COVID. It was just huge. And it had this one little line about kind of asking, well, doesn't the porn industry deal with like infectious disease, and they have to, this was when we thought we were going to reopen really quickly back in like spring of 2020. And I was like, porn industry, Los Angeles. So that one little throwaway sentence in that story, I'll put it in the chat. So I just did I called up, interviewing like actors, and it was so fascinating because they safely reopened in the age of HIV by having routine testing, electronic passes. Like if they tested negative for everything, they could work. And if not, and then somebody in the chat asked a really good question. How do we get original voices, and how do we find those people? And I think that's really interesting and a real challenge, especially when you're covering disparities, because a lot of the people are marginalized. And, I think we have a history in reporting of just exploiting people and having characters and just like talking to the person with lung cancer. And I've really rethought that. Like, what would this person get out of it? Could this harm that person? Do I need a person in this story? Am I just doing it because I think that's what we've always done? So I think really hard. Sometimes there's advocates who really want to talk. People who have experienced racism oftentimes like really want to share and be heard on that. So it's like, I think it's different. We've rethought about it, but I think there's stories everywhere. For me, it's commonly like, I'll do one story. I did a story on actually lack of diversity in clinical trials in Alzheimer's. And somebody just said, oh, have you heard about Lisa Barnes? She's got this huge collection of Black brains she's autopsying. She's a Black researcher. She is like so ahead of her time. And I tucked that away because it was COVID, but I had to go to Chicago for another story, and she works there. So I called her up and interviewed her. And that had been like, I'd heard about that tip like 2 years before. So it's just like kind of keeping track of all the ideas, but it's getting out and meeting people. There's, like Emily said, there's no substitute for that.
I love how you stack away those stories too. I think that's really important, and those little nuggets that you pull. We have another question from the chat that I wanted to bring up about someone's beat is not health, and it's actually Jamie, and he started off as a local career journalist, wants to know basically how you have large industry stories, but how do you make them hyper local, like insurance company stories or massive hospital closures? How would you make that a hyper local story? And if you're not on the health beat either, how could you do that?
I think the first thing I want to say is I want to reassure you that like health reporters don't necessarily know that much about this stuff either, in part because there's such a range of stuff that you cover. Like I think one of the things that's really challenging is that like each story you can kind of feel like an idiot again, and you have to kind of learn everything, a whole new disease or a whole new system. Like, I mean, with the kidney waitlist story, like I knew absolutely nothing about the transplant system going in. And so I just had a really huge learning curve. And now I'm hoping to build on that. But, every time there's a new topic. So I guess the first thing I'm gonna say is you're in the same boat as everyone. don't psych yourself out about that. I think the most important thing is to just think about how to make those stories relatable. Why will someone who's reading care? What will it mean for them? And to kind of just ground it in kind of what it means for their experience as a patient, most likely.
One of the other things that we wanted to bring up is because we've got reporters or writers who come from various backgrounds, like you're saying, don't worry, don't let it intimidate you. You could be writing on immigrants. You could be writing about language access issues. You could even be writing about entertainment. You could still find nuggets for health stories in those beats, right? So things like that are access issues. So for reporters that are already working on those or are mid-career and those type of things, what kind of advice do you have if they are covering transportation and they're looking for like, oh, access to transportation for health stories, like I can't get to the doctor, or what, how do I make that a health story? Like everyone's talking about the 405 traffic system and the 101, or is Metro doing great? How do you take those kind of stories that you may have to work on all the time, or that's your beat, and then bring the health lens to it? Does anyone want to help with that? Or
I feel like we have this phrase that's like, X is a public health issue, and you can literally put anything there. And it's like, seriously, gun violence is a public health issue. Nutrition is a public health issue. There's just like, literally you can fill in that blank and it will give you ideas. It's like a superpower phrase, I swear. I know we talked about this in our like pre-meeting, but I wanted to bring up the example of a video game reporter. Maybe some of you guys might be familiar with this, but a video game reporter who was reviewing the big, massive, long, overdue game Cyberpunk 2077. While she was playing the game, in order to review it, she actually had an epileptic seizure, and she's prone to seizures. And she realized that there were certain sequences in that video game that were, that were flashing lights, that were, basically like triggering epileptic seizures. And she wrote a whole story about it for Game Informer and published it, and it went viral. And she's like, I've written about epilepsy before, but no one's paid attention until now. And that story was so impactful that the game developers, Project Red, actually changed the game and put out a patch to mitigate those flashing light sequences. And so like, she just, her story had an impact on thousands and thousands and thousands of gamers. So that's just one example of like finding a health angle to a story. And it ended up being a really impactful story. So I feel like there's always an angle that you can take and make something into a health story.
Love your tip about how you fill it in also with a public health issue, like the fill in the blank, to make that. What about the mental health issues that are plaguing not only the nation, but in California? And how do we focus on those and be, whether it's a different beat, or whether it is just whether you work a different beat and it's not necessarily a health beat, or you're seeing something, you're like, okay, this is what's happening when I go outside to the store, or this is what happens when I'm at the local school waiting outside, and my kids are going in there, and this is what's happening with their classmates. Where are you looking for sources for mental health issues? What type of community organizations might you be turning to, or where are you finding stories? And just elaborate on what you also might like to cover. If you have the opportunity and your editor said, go, run with it, write a story on something that's happening in mental health right now in California. Who wants to take on that? You get to write anything you want. Usha, you got to have something stacked away.
I don't cover that topic, but I wanted to get back because I think I don't know if we really answered that question about how do you make these big national things hyper local. And I think that's a huge challenge. And I faced that in San Antonio. So I still remember it really well, but I think there's a couple ways. One is you must have like some university or community college or CSU or something near you, and they're full of experts. And UCLA is great, but if you're in like the Central Valley, there's schools there, there's schools everywhere. And oftentimes there's just amazing professors at these places, and they might be an expert on some of those topics. And I just rely so heavily on the kindness of experts to, especially like those issues you mentioned, like insurance and hospital closures. And I think hospital closures, that's an easy one, because if like a hospital was closing in your area, that's the very easy local angle. Or maybe a hospital closed somewhere in the region, and now there's tons more patients in your ER, and people can't get seen. So I think it's just looking for like the local impacts of those bigger issues. And if there aren't impacts, then maybe it's not a good story for the community. But if the community is asking about it, it probably is a good story. And I think sourcing ideas out of the community is just amazing way to go about things, because then you're really writing about things that people care about, and they may have really good ideas that you don't have to think about ideas then, because people are giving them to you, like the things they really care about.
I have one I'm working on, but I don't want to talk about it yet. But one that has already come out that I think could use a lot more attention from another reporter, Terry Sforza at the Orange County Register, has been doing this really interesting series on treatment facilities, addiction treatment facilities, and kind of the lack of regulation and just kind of the wild stuff that happens in substance use treatment, which I think is an area that just does not get covered much at all. And I would love to see more people cover that.
Lex, anything that you want people to cover more?
Well, you brought up mental health earlier, and I think that's a good way to, turn a story into more of a health story. My colleague, Janet Biafana at LA Taco, she did a series on street vendors, and she's done a lot of reporting on street vendors before, but I don't think that she also reported this story with another reporter, Jack Ross. I don't think either of them would necessarily think of themselves as health reporters, but they've been doing a lot of really great, important reporting on street vendors. So they actually applied for the same fellowship that I did, and did a series of stories on street vendor mental health and how, repeated attacks, enforcement and sweeps all impact their mental health. And that story did very well. They're just nominated for a bunch of LA Press Club awards. And they also did more than just, the stories, they also engaged with the community. So yeah, I just wanted to point that out as an example of how you can, maybe take your main beat, the thing that you write about the most, and then, kind of apply a health angle to it.
Yeah. I mean, even like now in the current news where we're hearing about the, and it could be a problem, folks, with the Writers Guild strike. There's some people that have benefits and some people that don't, and there's other people. So there's a lot of people reliant on those, and people look at that and say, oh, well, that's just a middle class, upper class problem if you look at that strata. But then you start looking at how it tapers down to other folks who are doing other jobs, and what happens to their lifestyle, and then what happens to their kids and getting healthcare. So I think there's a ripple effect. I was talking to a entertainment journalist who said, she's like, I want to do a story on what's going to happen to like the kids of the Grips, or the kids, the security guard who was on the set, and they cannot, because summer's coming up and this is the time they might go get a checkup for their team, and they're reliant. It's not just that they have insurance benefits, not that they don't. Some of them those are day jobs when they're working as a security guard on a set that has shut down. And those are the types of people that pay cash for a doctor's visit. They don't have enough, or they go to a clinic where they know, and they, it's minimal, and they can't do that now. So someone was telling me that they're looking to write that story. So it's interesting how you can uncover stories in every beat and locally too. I just wanted to add that in for when you're looking at things like that. That had been brought up to me, and I said I'll mention that tonight, so that anyone who's coming in with different ideas, even looking to write something at the fellowship, it might be timely to look into those.
I think that's really true. There's the LA Times did that great series on what's happening with Metro, and that was sort of like a transportation story, but to me it was a health story. There's so much like addiction and suffering and again, a lot of blaming language, but on those trains. So to me, that's a health story. You look at like some of the very best early writing on concussion in football, those were NFL reporters, those are sports reporters who are like about as far as, in the newsroom from health reporters as can be, and they did amazing work. So it's just like, if you're a good reporter, you've got your ears and eyes open, and you're just seeing things and you're questioning things. In any place you go.
No, and that's a really great point that you also make about the sports reporters and where some of those stories start, not just on concussions, but where people become alert. Like, look what happened with the football game, with the NFL game, and how interest in heart disease and sudden heart attacks took place because of a Buffalo Bills Cleveland game, right? And how that raises a national profile. And that story that was national became local because everybody went and talked to their local hospital cardiologist, or would be talking to the practitioner in their area if there wasn't a university, to find out, could this happen to anybody next door? So I think that those have ramifications. You don't have to necessarily be a health reporter or sports reporter to get those. So I think everybody's, and it just spirals down. So I think people look for those stories as well too. And it's great to find sources for that. I was going to ask you about community sources. Like in California, we have so many different places that you have an Alzheimer's researcher that you could get at UCLA, or you could find a community foundation that's, working with certain ethnic communities. Do you guys rely on those for sources as health reporters? Do you use those as sources? Do you reach out to them? And so when you have a story that's applicable, if you need either an advocacy group, or you need to find if there's local clinics to see what people are experiencing, maybe now even with monkeypox, are we going to be talking to people and saying, where are they going to go to get vaccinated? Or is this something that you automatically have as sources that you cultivate?
I mean, I think community clinics are amazing. They're like beacons. So I just had a great conversation with the head of the whole Community Clinics Association of California, because they see what's happening on the ground. We also get, once you've been in the beat for a while, you get a lot of too many press releases. So I think it's more that they're reaching out to us, and we just can't cover it all. But I'd love to hear what other people think.
Well, I was going to echo that. When I was a health reporter, I actually did build up relationships with a lot of community clinics, and especially back in the early 2010s, during the rollout of the Affordable Care Act. And it was really interesting to talk to them and see what they were seeing. And, obviously there's issues with protected health information and HIPAA. So, but a lot of people could just talk in general terms and about what they were seeing and what they were experiencing. And community clinics was the way I did it. Yeah.
We're going to take questions in about 5 or 10 minutes. So everybody just get ready to put your questions in the chat, and we'll just go down and do those. And also I'll take some others. But I wanted to ask also about what we're noticing with health disparities, what you're noticing maybe in certain diverse communities. For example, the Asian community, the women are the least to get mammograms of any other community. And this may be because of historical nature. This may be because of stigma, their own, to talk about it with family members and things like that. Are there stories that you're noticing or that you've reported on in the past that were surprising to you? Lex, you cover a lot of this with different populations. Wanted to ask you things that you've noticed, whether it's language barriers, whether it's, other things that are, like Usha's talking about obesity rising in certain communities. There's others that have, and we're not trying to say, oh, it's because of this community is of this race that they have this, but it's like, what is the solution? Like you were saying, Emily, with that book that you held up, and I was like, we can promote again. But how do you look at stories like that? When it affects Latino communities, Asian communities, Black communities, Native American, where do you go talk to people, and who are resources and experts for you, and what have you been noticing in your coverage, maybe post? Well, I'm going to say post-pandemic, but for those type of stories now, or the interest, because we weren't able to cover that so much for 2.5 years. Anyone want to go first?
I can mention something. One of my writers brought a story to me like a year or so ago. She was getting her skin checked out for melanoma, and it turned out she would need surgery, and she's Latina. And she was like, did you know that Latina skin, incidence of melanoma has risen by 20% in the last 10 years? And I was like, oh, okay. Do you want to write about it from a first person point of view? And she was like, yes. And she wrote this great story. And where she sort of went into both the systemic and the personal reasons that she never got her skin checked. She never used sunscreen. She it was a beautiful story, and I'll find it and drop it into the chat, but that was just one thing that was really surprising to me.
No, that can, and that happens a lot. There's a Skin of Color Society of dermatologists who actually serve as a resource for men and women of color, because people don't expect, some people like in some cultures say, oh, I'm already, olive skinned, I don't have to worry about putting on sunscreen, or they never go to a dermatologist because it wasn't something that was talked about. And it's expensive to go to a dermatologist too. It's a specialist. It can be out of your plan if you're not in a plan, that's even harder. Or you are you're in the sun because of your profession and you never thought, so these are interesting points to bring up, but that's another. Emily, do you have some experience with that too?
Well, one thing I was thinking about, just one category of disparity that I think we don't pay enough attention to is disability.
Mm-hmm.
And I think, one of the big lessons we saw of the pandemic was how shockingly acceptable it was to completely discount the deaths of disabled people and the higher risks of disabled people during the pandemic. If there's one thing I can impress upon everyone today, I would really like to banish the phrase suffering from autism, just completely. I know a very sweet autistic 6-year-old. He does not suffer from autism. If he suffers, it's from ableism. And so again, whose fault is that? Not his. It's the forces acting on him. So in general, I just think there's just a ton of ground to cover in disability and the world of disability services as well.
Before we go to questions, I'm going to ask what you would recommend, what advice you would have for anybody who wants to cover the health beat. So since I started with Diya, I'm going to go and ask Lex first. Lex, what advice would you have? You have you've done these great fellowships. You're out in the street. You've got this amazing text going. I mean, you've got a lot already. I've learned a lot from you in the last 50 minutes. So for those that are just wanting to do this, what advice would you have?
First off, thank you. Someone else brought up, like if you're trying to find ideas, I think one thing that definitely helps is talking with other reporters. Like even with the hygiene station story that I didn't really think of that as being a health story at first, even though it had to do with public hygiene and, washing your hands and stuff. But, talking with other reporters, that's kind of what led me to apply for the data fellowship, which basically changed my whole career. So, I think having conversations with your editor or other writers might be helpful if you have some ideas in your head that you're unsure about. So that'd be my piece of advice.
Usha?
Well, I would say don't be intimidated at all by it. The questions you have, the things you're curious about are probably things readers are. So just like follow your instincts. When you're looking for stories or thinking of things. One challenge is that so many topics, like so much has been written about, like heart disease, like women get heart disease, and so how do you, I think we need really new, young and creative people to like look at things differently or find a new angle on it or talk to someone different. Yeah, talk to Black women about skin cancer because they've been completely ignored, for decades and decades. Or finding diverse sources. I think they have whole new views on things that maybe haven't been covered by the mainstream media. So just just like trust yourself and just go for things. And you might have to, I think newsrooms are very hierarchical. So they might be like, but you don't cover health. And so you just have to really just argue for if it's a story you really want to do, like why you should and why it doesn't matter, how it crosses beats. And hopefully editors are open to that.
You got to pitch your editor and try to get them to do it. I think they're becoming more open because they're seeing how everybody, like you said, it's selling on the newsstands and that's where they're getting the eyeballs on these stories.
I wanted to chime in with what Lexis said. What I really admired about that series about the sanitation stations was that it was just such a great example of keeping your eyes open. Like if you follow Lex on Twitter, like you just saw him like seeing these stations all the time. And we're like, here's a station, it's not working. Like here I am, like trying to get the soap out of it. And I think it's just a really great reminder that like just those basic things, like like you're saying, the things you would go back and like kind of talk about with a coworker are the things that tend to be good stories. There's like a Gene Wilder quote about like who he makes movies for, where he says like he's picturing this particular woman And he says something a little offensive, I'm not gonna say, but he basically says it's a huge effort for this woman to get to the movies. And so when she gets to the movies, she wants her to laugh, she wants her to have a great time. Like he just sort of like has this person in mind about like who he is trying to make a movie for. And I think with coming up with stories, sometimes it kind of helps to have that too. Like thinking about like, how do I explain the story to my grandma? Or like sometimes, how do I explain the story to my husband who, you know, is interested in these things, but is not, you know, totally in that world, right? So just having that sort of person in mind and thinking about things in that kind of just conversational way, I think is super helpful.
So we're going to go to questions in the chat, but Ada has a few questions that she wants me to ask. So I'm going, or Ada can chime into, but here's what she wants to know. It can be easy to find doctors or scientists with opinions, but especially with cutting edge research or debated ideas, their opinion isn't fact. What's your approach to fact checking experts when you don't have a PhD or an MD yourself as a reporter?
I can answer that, and
Okay, Diya.
or at least I can give one answer. I'm sure everybody has different answers, but what I would suggest to do is to ask the researcher you're talking to, is there anyone who disagrees with me? Or is there anyone who disagrees with you, and can I talk to them? And you ask that person, because a researcher, a scientist who has done a story or study will have it peer reviewed, and there will be people who disagree and are like, well, my results over here are completely different than what you got. So, and they know each other, they know about each other. So the best thing to do is just ask the quote expert you're talking about, is there anyone who disagrees with you, and can you give me their contact info?
Yeah, that's just such a great question, especially.
It's from our chat. I was wrong. It's not from Ada. She's sending me questions, and I was like, wait a minute, I'm not multitasking well. So credit to the chat. I have to source properly. I don't want to get in trouble for not sourcing. So yes, go ahead.
There's so much misinformation right now, and I agree. Like but there's a lot of dishonest peddlers who would be like, no one disagrees with me because I am right, and no one should wear a mask, and So I think one thing you can do is. If you have another source you trust, maybe they can tell you off the record what they think and give you the straight skinny, but you're not going to quote them on that. And maybe that is just like a physician that you trust that maybe isn't like a national expert, but is following this. Twitter's helpful for this because you can follow people over time and you can follow the arguments. If it takes a lot of time though. And mental energy, but I think you have to be extra careful. And if you are just new in health reporting, you really have to, you don't want to be taken advantage of by someone who knows you don't have a lot of expertise and has you continue to peddle the misinformation that's coming out. But you can also like read other news stories on it. There's sometimes things called review articles in things like JAMA that they try to write them more for like a non-specialist audience. So you sometimes have to do your homework on some of these really like politicized issues. And I think it wasn't this hard like 10 years ago.
You're right. You're right. Another question we have is, what trends have you observed regarding accessibility to health services for persons with disabilities? And what issues in this area do you feel need more awareness and need to be covered in greater detail?
The complete dysfunction of the regional centers. Sorry. And I say this partly as a client, but so for folks who are not familiar, services for developmentally disabled youth and also some adults come through the system of nonprofits that contract with the state in California called regional centers. And it's not necessarily health services, although often they're involved in kind of connecting people to those things. And it's a big mess. There's been a lot of reports out about disparities in, the types of services that people get as a result through those nonprofits. And yeah, I just think it's an area that tends to not get a lot of attention because it doesn't fit neatly onto a lot of conventional beats. And so that would be one area that could really use more attention.
I wish it could be a beat of its own, because I think someone could just rock that and find so many stories because it's so undercovered. I do think COVID showed it with all the people getting long COVID and that giving more, I don't know, a spotlight on Epstein-Barr and all these other chronic conditions, but that we had before COVID. I think there's more attention to it now, but I'm worried. I've just been worried like this, everyone wants to get back to normal. And, I do too. I'd love the pandemic to just be gone, but I worry about the push to get back to normal, then we'll be like sweep everything back under the rug, like disabled people and their issues. So I think someone could make an amazing beat out of just covering disability.
Yeah, no, I think there would be great if we would have reporters to be able to do that. And it'd be nice to have to see regionally too, what's going on, because there's so many different issues regionally that go on for disabilities, because I think there's certain states and even counties that are much more helpful, so to speak, than others that just want to sweep everything under the rug. So I think that could be a great beat, and I don't think it gets enough coverage at all. So what about, someone's asking, there has been a lot more coverage, and we touched on this very slightly, but let's talk about this more, on behavioral mental health issues. How did that come about? So who wants to take that on? I think there was never enough coverage before, and I think that there still isn't enough coverage, and I think people were stuck for 2.5 years in their homes. They're like, oh my goodness, this is something we have to talk about now, because everybody was going a little bit having their own issues. So, but I'd love to hear everyone and how they.
This is just observation, but I feel like just as time has gone on, and especially with social media, and people sharing things on social media, the stigma is starting to lessen a little bit than it has for previous generations, and people are a lot more willing to talk about it. And I mean, even before the pandemic, you kind of saw that on social media, Instagram and Twitter and Facebook and so on.
I think the stigma's less, you're right. And not only social media, but also I think that the conversations between young and old are taking place more than, the generational on mental health, the conversations that didn't used to take place, and that is due to stigma. So I think that's bringing it up too. I mean, there are kids now that talk about from their TikTok videos about, and then there's other therapists that are going on there discussing mental health. That's not saying that that's a substitute, but it brings the subject to light. And also, you mentioned something before, Diya, which I wanted to bring up, which is like the gaming situation. There are gaming organizations that say, when we play together on Discord, it's a way to deal with mental health and have talks. So it's quite interesting what's happening with that. But I think the mental health services are getting cut back and back more and more. So there's a story there as well. I mean, even though that there is a push for it, I want to know what really is the funding, who's doing those stories too, because I think that's a tie-in of 2 beats there. I don't know how much coverage that is getting as well.
I think it's interesting, that perception that there's more coverage, because I agree with you, Gita. I don't feel like there's enough. I also feel like this coverage we have is the same story told over and over again. Like the stories I see are like, does social media hurt teenagers' brains? And oh, everyone's so lonely because we're not back in the office. And these are very like white, wealthy issues. I don't see like, why can people not get access to medicine for their schizophrenia because they're unhoused? I mean, I feel like we have huge mental health stories, and we keep, I don't know, I think maybe I'm not reading the right publication.
No, I think they're hidden.
It's like the same story over and over again, and they're very like, they're important. They're important to people who suffer them, but there's so many mental health issues that I don't know, just aren't getting a lot of attention.
Right. Like there's stories like there was a lot of assisted living centers for folks with mental health, but then with COVID, people didn't want those situations, and then they were being used for different things. So it's like, what happened to all of those people that had schizophrenia or were getting therapy on site, or were going before they would have day mental health programs, and they would have group therapy, or they would have an art therapy session that shut down for 3 years. What happened to those folks? Who's helping with them get resources or things like that? So it's very interesting, and those vary. But that's a story that has not been covered in California. And I've talked to people about that, saying, our relatives used to deal with this. And now, we were told when COVID happened that they couldn't stay in those facilities, or they would not, the therapist wouldn't come in to help them. So it's been extremely heart-wrenching to hear those stories, because I feel like we're hearing the same ones again and again. I mean, we are hearing about teen mental health, which we know has gone through a lot and things, but there's other folks too that have also been touched And I also think one story that you already touched on was what's happening with the mass shootings. That has become a healthcare crisis, and that has become a beat. I wanted to mention that because when healthcare fellowships, when we are plugging those healthcare fellowships, but there is a beat that a lot of network, like CNN has a reporter up for the shootings and to discuss mental health. So some other organizations are making that a beat because they want to show the ramifications, but it does touch so much on healthcare too. And you see physicians writing letters to the editor, or groups of physicians joining us saying, and pediatricians saying what type of problem this is as a healthcare issue. So it's important.
Yeah,
you know.
I moderated a panel earlier this year actually for physicians about their own mental health burden from shootings, just constant dealing with shootings. And I think that there's room for some really interesting reporting on just the mental health of health providers, which can be a hard thing to write about, because I think often physicians don't want to make it sound like they're the victim. They're obviously like caring for people who are in really horrible straits, and it can be hard to get them to talk a little bit about that. But it is kind of amazing that our whole system of training doctors is so not conducive to good mental health. If you've known anyone who's gone through it, it's just like the sleep deprivation alone just seems incredible, that we expect people to function well and care well for others while doing that. My dad used to work with kids with cystic fibrosis, which if you know, it's a disease where your lungs produce too much mucus. And it used to be basically, I mean, when I was a kid, it was deadly for a lot of children. It's changed a lot now. Now people live into adulthood. But when I was a kid, there were weeks when he would just have kids just die, and there was nothing to do about it. And I just remember what it was like being in our house when that would happen, and what that meant, just kind of seeing him deal with that without really any support at all. I can't imagine if you're someone in an emergency room constantly seeing what's happening with, we focus a lot on mass shootings, but kind of just the daily toll of gun violence and kind of these smaller one-off shootings, just watching that nonstop, what that must be like for people. And I don't know quite the best way to tell that story that doesn't, feel like the focus is in the wrong place, but I think there is some interesting work to be done there.
No, I think that's really important to address, because we talked about healthcare workers and everything during the pandemic and what they went through and now with the shootings, but a lot of the pressure writing those stories has gone off. It was not just healthcare workers, it was, the frontline workers. And ironically, it was also veterinarians, because people adopted all these pets that were coming in. And so the mental health of that, the suicide rates and all those things were going up of those specialties as well. So it's amazing that ripple effect that happens. Teresa has a question she wants all of you to be able to answer, which is, if you were to take any beat, because we're talking about how to report on health in any beat, and suggest a health issue that could be covered in it. So let's say you took the entertainment beat, or the sports beat, or the immigration beat, or transportation, if these were to interest you, or let me think what else we could do. What any of those, as far as it could be, and how you would find a health story in it. So if there's something there that we touch on it a little bit, but just if you want to think about that.
Like what beat would you take?
You took Usha, you took the entertainment, like when you were looking at that, what happened with the porn stars, I felt like you were looking at the entertainment industry and like what was happening. So you took a different beat, and then you were able to suggest and pull out a health story. So if it was something else, like what you could pull out, how to report on health in any beat, obviously is our thematic here. So we're just trying to see if there's anything that you normally, if you're not a health reporter and you're covering other things, how you could bring it out. I mean, Diya gave us her tagline about how she uses the fill into something for public health.
I actually think the business beat is like an untapped mine of great health stories, especially if you're looking at it from the labor perspective and the perspective of workers and what workers have had to endure all these years, with salaries not changing and inflation and, the reduction of unions and like less worker protections, honestly, the lack of insurance, less PTO, more stress. There's just so much there. I think that's something that would be really cool to pursue.
Yes, and like, for example, Teresa, of course, Teresa Watanabe, who I'm speaking of, works on the education beat at the LA Times. So if you looked at teachers or professors and the stresses they endured, you could write about, or what has happened with their medical care. How would they take days off? You know, how does that work if they need something, you know, or the kid, or you were talking about the school nurses, you know, that are no longer, I mean, there's a lot of schools that don't, public schools that don't have a school nurse anymore. It used to be.
Or one nurse covers like eight schools. Spend a day
Right.
with that person. That is an
I
excellent
remember
thing.
the days where there would be a half day where the school nurse would come 2-3 in a public school, you know, they didn't even have full in 2-3 schools. So now it's there's a rotation if you get them. So there's different ways to look at it as well.
Food is an incredible lens too, to look at health, like food deserts, what are, you know, what can people access? And it's something like everybody cares about.
Yes. Now I want to ask you if just to think of one of your favorite stories that you've written, excuse me. Well, it could be read if someone else's, but written, and tell us about, you know, what went into it, how you came up with finding it, because we're trying to inspire people for this fellowship and to be able to get their $2,500 fellowship, how you found the story, what brought it on, how you sourced it, you know, maybe also what took in the time you took to writing that story. You know, some people think, oh, these stories can take months. Others are like, no, I only had 2-3 days to do it, or, you know, whatever. Or Diya's writing a newsletter. She's having to pump something out on a daily basis. Usha, you got some more time with stories, but in the past you didn't when you were in San Antonio, you know. Emily, yourself, and Lex, you're texting with folks all the time. I'm sure you're getting lots of ideas, but it's like, what can you really uncover? So take a moment and just let us know which ones would be some of your favorites that you've written about. Emily, even the partial Pulitzer counts at this point. You're on mute. Usha, you've done a lot on disparities. So is there one, I mean, so many stories.
Yeah, like it was pretty early in the pandemic, and remember we were like banging the pots for the health workers and bringing and like there were all these tributes, and whenever they died, the names would circulate, and I just noticed I was seeing so many Filipino names among the healthcare workers that were dying of COVID, and so I was like, and then I started looking into it and I discovered, Filipinos are like a small fraction of our country, but 20% of California's nurses are Filipina. So I found a Filipino Nurses Association in New Jersey, and the executive director was like dying of COVID, like as I was calling. So she couldn't talk, but someone else talked to me, and I talked to the head of USC nursing is a white woman, but she's married to a Filipino physician, and she put me in touch with all her nurses, and someone at UCLA had just been disciplined because she wanted masks. And a big thing is like Filipinas don't speak up about things. And so that was like amazing for her to do that. So I spoke with her, and we were able to just show like, and these are people that are working 2 shifts. They're the ones at the bedside intubating people. And I remember one Gem Scorp, I still remember this conversation. He's like, who's like, why don't you see us on TV? Because we're with the patients as they're dying. We're holding the iPads up so they can say goodbye to their family. And so the white nurses are on TV. And it's just sorry, I'm like getting emotional. It's just heartbreaking. I still think about that story. And also I beat ProPublica on it. So I was very happy about that. And I was able to get my story out first. So sometimes I'm quick.
Yeah, that was a very interesting story. And there was a group that Liesl Tenglo, who started for Filipino folks that wanted to get COVID vaccinations, because she was discussing in the community, the only way that they were going for COVID vaccinations was like via a telephone tree, because it wasn't really, or people were, that's how they were telling people to call each other up and arrange them. And she's got a whole thing that she's a former journalist and she's a former AAJA member, but I know she brought up that cause very much so, and has been trying to raise the awareness in healthcare issues for Filipinos, even though so many work in the Filipino community, like you're saying about the nurses. But it's to get them to actually get in and get their boosters and all is also interesting as to how that works too. That's the other side of that story too, because it's not just just because you hear it on a regular, I would say like one of your 3 channels or a mainstream does not mean that that's how it gets to the community. It's more word of mouth, or sometimes an elder or a younger generation taking you to go get that booster vaccination. So the community has its own effects. Well, that
Well,
go ahead.
Sorry,
Emily.
I was going to mention one that I think it kind of goes back to like just the stories that you want to gab with your coworker or with your grandma about. One thing I've tried to focus on a lot on the public health beat is the overdose crisis. And at one point I was just trying to learn a lot more about medications for substance use disorder treatment. And I'd called someone at a harm reduction organization, wanting to talk about buprenorphine. And we kept her on. She's like, yeah, I mean, yeah, sure. But, really, the issue is like, there's no methadone on Skid Row. I said, what? And we talked a little bit more, and she said, yeah, actually, I've been driving someone like every day to get her methadone in Boyle Heights, because there's no methadone in Skid Row, and she doesn't have transit, and she's disabled. And it's really important to me that she is able to, she's on a good path, and it looks like she's able to, going to be able to kind of shake off her addiction, and I want to help that for her. And I was like, all right, my entire story has changed. Like, this is what I want to write about now. So that was one that I think it just, again, kind of comes out of thing of giving yourself time to explore and listen to people, and not being too focused on like what you think the story is going in.
That's really good advice, that the story can revolve, you can find something that totally changes it, and you have to be ready for that and be nimble. Yeah, that's really great. Lex, do you have a thought on that as well?
I guess with my hygiene station story, to Emily's point about staying on the story, that was a story that I found just by like going on these long walks during the beginning of the pandemic, because I basically like lost all my work. And on these walks, I'd noticed the hygiene stations, and after days and days of seeing them and seeing that they weren't being maintained, that's when I started to share my findings on social media, which ended up getting the attention of an editor at Curved-LA, which doesn't really exist anymore. But they approached me about writing the story basically just by seeing my tweets. And at the time, I didn't have any data skills, and there wasn't really any data about even where these hygiene stations were. So to write a story, I just would like walk to them every single day for a week or two, and basically created my own data. So that was the foundation of the hygiene station story. And then Curbed, they were sold, and their newsroom was gutted. So I ended up taking the story to LA Taco, and eventually getting into the fellowship. So it was really the result of putting my reporting on Twitter, honestly, that caught the attention of this editor. And then like a month or two after that, another reporter, they had obtained a bunch of assessment records from the city that showed like the soap, water, paper towel levels at all these different hygiene stations. And they gave me an exclusive on the data, which was like the foundation of my fellowship project, and I think a big reason why I got that fellowship. So yeah, again, just staying on the story and doing a little bit of reporting. I think that's kind of the best way to see if you have a good idea.
Great. We have another question that's come in, and then we're going to talk about the fellowship, if you don't mind, which is, what is the best way to share health equity stories or leads? Does anyone have any thoughts on that?
Like to us?
Yeah, they want to share their story with a journalist. Is the best way to get you on social media, to DM you, or to send it? What would be the best way to share a story if they want to tell you something that's a health equity story?
Yeah, for me, it's a
Tip.
thoughtful email in explaining what it is and who's available to talk, and but also like checking if I've already written about it is good, or if my outlet has. I get so many pitches for stuff I just don't even cover. So I feel like you find the right person, find someone you like their reporting, and that they do cover that area, and that they haven't written that same story. I mean, I do
Right.
read my emails, get a lot of them, but I do read them.
And I think sometimes it's the outlet, like what is the outlet covering? Like, LA Taco may be covering different things. There's a couple outlets like Word in Black, Capital B that will cover stories that are Black community stories. So you have to think also where it could be Univision, Telemundo, you could be going there for certain stories that are affecting the community. So also think like, hey, is it going to affect the community so that they'd be really interested and want my lead? I always think of that reporter, what they've done in the past too, to pitch them a story. That might be helpful as well. And I think Ada is going to come on now and talk about these great fellowships that we're offering up. So Ada, would you like to get on screen and just go through what we have available for folks so that this is the inviting to them to apply, hopefully, for the 3 fellowships that we have available.
Sure. Can you guys hear me?
Yes.
Okay. I just want to thank you all for such a great panel. I think when I, think of this topic, reporting on health in any beat, I feel like, during the pandemic, so many of us who, oh my gosh, your kids. I just ran away from my kids. Like, you need to go there for 3 minutes. But anyway, I think like during the pandemic, so many of us who didn't cover health were pulled into cover health, and it was so nerve-wracking, and I like kind of the fact that we had to do it, and kind of changing the perspective of that now and sort of seeing it as an opportunity, because now we've gone through 3 years of all of us talking about our health a lot, because we were so scared, and now like no matter what beat we're on, we have the opportunity to cover health, and it's really great to hear your stories and just hear the encouragement to us who might be scared of it. But yes, I'm here to talk about the fellowships, because we have these 3 fellowships from Cal Endowment, who's also funding these panels, and let me share my screen so you guys can see. Loading. But there we go. So it's our 2023 Health Equity Fellowships, and there are 3 25,000 reporting grants for 3 months. Oh, sorry, I'm reading wrong. So it's 3 grants for $2,500, and we really encourage anyone to apply for this. It's we're looking for proposals for reporting projects that explore health equity issues that affect the Asian American community. And as we're talking about inequities, part of that is certain communities getting more coverage than others, right? So we encourage like anyone to apply, whether you're a journalist starting out or been reporting for a while, and also like if you're a freelancer, I think this might be like a good opportunity to get kind of this funding to work on something for a long time. But also we encourage people who are on staff to apply, because there's we're encouraging like community engagement stuff like Lex was talking about, and sometimes that stuff requires like money. So if you have travel needs or translation needs, like you could go to our website to learn a little bit more about how to apply. But basically, we'll just ask you to kind of pitch your idea and what you would use the funding for. And the application deadline at the moment is June 15th. But I also wanted to tell you guys that this is the first of a few panels that we have coming up. This one, it's to sort of hear from the health journalists about the stories that are covering. We're going to plan one in the summer about community engagement specifically. So, if you have ideas, we want to, we're going to invite, folks to kind of talk about how they did community engagement. So hopefully you can sort of pique some ideas of how to add that to your reporting. And then we're going to have another one where we can sort of see the results of these stories that hopefully people get to report the grant. But yeah, so that's just my little pitch for that. Not only if you're interested, or if we all know reporters here. So if you know other people who would be interested in applying, help us share. And then I'll throw it back to you. But here's we have the contact.
Yes, I was just going to say that we wanted to thank everybody on the board that helped put this event together, the AAJA-LA board. And we especially wanted to thank also some of our past presidents, Ando and Teresa Watanabe, who's our current vice president of programming, but our great guests who came on. We couldn't have done this panel. We know you're all really busy to give up so much time tonight. So Usha, Emily, Lex, Diya, we're really, really grateful that you came on. Hopefully you'll come. We're going to have our second event. And if you want to join us, where we're going to have some community groups that we would be covering, and we'll, that you might want to use for a story, we will put that word out to folks. But we're trying to think of it like a speed dating source event, if we can get our all of our ducks in a row, so to speak, with different healthcare foundations and sources. It would be nice so that they could serve as resources for folks too, and so you could meet who you might want to report on. So it would be helpful, and then we'll have a little bit of a mixer too, so that everybody who's can hopefully meet in real life with, as Usha says, following the proper protocols too. So we really appreciate that, and we thank you all for coming tonight and giving us so much time. So if there's any other last words, I'm ready to say good night and thank you so much. And we look forward to reading some great stories, hopefully, that come out of this this session from the fellowship, and have inspired you all to want to write something or get involved on a health beat. So thank you all for your time.
Thank you so much, everybody.
Bye-bye.